Hypnic jerk. A hypnic jerk, also known as a sleep start, is a sudden involuntary muscle contraction that occurs while falling asleep. It often feels like a jolt through the body and may be accompanied by a sensation of falling, a flash of light, or even a loud bang in the head. These events can be strong enough to wake a person suddenly. Studies suggest that around 70% of people experience hypnic jerks at least occasionally. One explanation is evolutionary. Early humans or primates may have developed the reflex as a protective mechanism to prevent falling from trees. Another theory is neurological, where the brain, shifting from wakefulness to sleep, mistakenly sends signals that trigger the muscles into spasm. Fatigue, caffeine, and stress often make hypnic jerks more frequent. Sleep paralysis. Sleep paralysis is a condition where a person is conscious but unable to move or speak. It usually occurs during the transition into or out of sleep and can last for a few seconds or up to 2 minutes. Many people describe a heavy pressure on the chest, difficulty breathing, and a strong sense of fear. The condition is caused when the brain wakes before the body has finished its natural REM paralysis, which prevents us from acting out dreams. Hallucinations are common because dream imagery can spill into wakefulness, making the experience feel terrifyingly real. Lack of sleep, irregular schedules, and stress increase the chances of an episode. Exploding head syndrome. Exploding head syndrome is a harmless but startling sleep phenomenon where people hear a sudden loud noise just as they are falling asleep or waking. It may resemble a gunshot, crash, cymbal clash, or electrical spark. Although it sounds alarming, it causes no physical harm. Researchers believe it happens when the brain fails to shut down smoothly and neurons in the auditory system discharge all at once, producing the illusion of an explosion. Episodes are more common during stress, exhaustion, or periods of disrupted sleep. Lucid dreaming. Lucid dreaming occurs when someone realizes they are dreaming while still inside the dream. With practice, some people can even control the story, interact with dream characters, or alter the environment. This makes it one of the most fascinating sleep experiences. Brain scans show higher activity in the prefrontal cortex during lucid dreams compared to normal dreams. People train themselves to become lucid by using techniques such as reality checks, dream journaling, and practicing mindfulness before sleep. Lucid dreams can feel vivid, empowering, and sometimes therapeutic, helping people confront fears or rehearse skills. False awakenings. A false awakening is when a person dreams of waking up, often carrying out their morning routine, only to realize later that they are still asleep. Sometimes the dream can repeat in layers, creating the unsettling sense of waking up several times in a row. This usually occurs when the brain is anxious about waking, such as before exams, travel, or important events. Because the brain uses fragments of real surroundings, the dream can be very convincing. People often describe false awakenings as frustrating or eerie. Dreamtime distortion. Dreamtime distortion refers to the mismatch between dreamtime and real time. A dream that feels like it has lasted hours may only occur in a few minutes, while short dreams can feel stretched out far longer than they are. The effect comes from the brain's altered time perception during REM sleep. Since the prefrontal cortex is less active, the brain condenses long narratives into bursts of activity. This creates the impression of extended experiences within a limited time. Some lucid dreamers even report controlling or bending the sense of time inside dreams. Sexsomnia. Sexsomnia is a rare sleep disorder where people engage in sexual activity during sleep without conscious awareness. It can range from making sexual noises to initiating physical acts, sometimes with a partner, but the individual has no memory upon waking. It is classified as a type of parasomnia linked to non-REM sleep. It happens when instinctual brain areas remain active while self-control regions are still asleep. Triggers include alcohol, drug use, fatigue, and stress. Although unusual, it can create distress in relationships, making diagnosis and treatment important. REM sleep behavior disorder. REM sleep behavior disorder, that is RBD, is a condition where a person acts out dreams physically because the usual muscle paralysis of REM sleep does not occur. Movements may include shouting, punching, kicking, or even running out of bed. Injuries to the sleeper or their partner are possible. RBD is most often found in older adults, especially men, It is sometimes an early sign of neurological conditions like Parkinson's or dementia. Treatments include medications and safety measures, such as making the sleep environment secure. Sleep talking. Sleep talking, also called somniloquy, is when a person speaks while asleep without realizing it. Speech can range from nonsense words to full conversations, and it may last only seconds or continue through the night. It can occur in both REM and non-REM stages of sleep and is often harmless. Stress, fever, alcohol, and poor sleep habits make it more likely. Children experience it more frequently than adults, but it usually decreases with age. Sleepwalking or somnambulism happens when a person moves about while still deeply asleep. Actions can be simple, such as sitting up in bed, or complex, like cooking, leaving the house, or even driving. The person usually has no memory of the event the next day. It occurs most often in children, but can also affect adults. Genetics play a role, and it is more likely during stress, illness, or after taking certain medications. Though usually harmless, sleepwalking can be dangerous if the sleeper enters unsafe environments.